Vitamin D is a very, very powerful supplement. And it is a hormone, but it's also what's called an immunomodulator. So it modulates the immune response. It also modulates about 1,000 genes that can switch on and off and improve inflammation in the body. So it decreases inflammation. It causes the production of certain proteins in the body called AMPs or antimicrobial peptides. And these proteins, they open up a pharmacy in your body of antivirals and antibiotics that kill viruses and bacteria. So when we talk about, say, the elderly having a much poorer prognosis or a reduced immune response when it comes to infections and COVID-19 in particular, we're forgetting that the elderly in America have an average vitamin D level between 10 and 20. And if we increased the vitamin D level to 50 to 60, the elderly would have a much better prognosis if they got COVID-19. And not just the elderly, but all of us, because we need that amount of vitamin D in our body to trigger the antimicrobial peptides, to trigger the antibacterial effects and antiviral effects of vitamin D in the body. And vitamin D, as a matter of fact, has been shown to punch holes in the capsule of coronaviruses and destroy them. So my question is, why aren't we talking about this? Why are we not offering suggestions of evidence-based methods that we already know that work for COVID-19, that work for coronavirus, that work for viral infections and bacterial infections? If we can bring our vitamin D level to about 50 to 60 or 70 in our bodies, we'll have a much better prognosis and a better chance of recovery from COVID-19. We also want to increase the antioxidant levels in our body. So vitamin C is a perfect antioxidant for us to use, which has actually been shown in IV form in patients on a vent with COVID-19 to reduce their hospitalization. So we already have proof that vitamin C works. My suggestion to my patients is 2,000 milligrams of vitamin C per day. We know that zinc works. So zinc 20 milligrams a day has profound antiviral effects. And what it does is it sticks on the virus, so the virus is incapable of hijacking your DNA to cause its replication. We know this. This is not new news. None of this is. So what we want to do is apply what we know so that people in the community can be protected and have a toolkit so that you can take care of yourself during this pandemic. Last but not least, the plant-based diet, which is extremely, extremely important for all of us to begin to transition towards, will alkalinize the body and make our pH unfavorable for COVID-19 to replicate. So what we really want to do is make conscious choices. Eat more consciously, eat more plant-based. We know the Mediterranean diet works well. We have ample data, 30, 40 years of data on that. We need to start to include that in our lifestyle. Exercise, we know, increases the immune response. There's a lot of literature that has shown that exercise enhances our immunity, increases our response to viruses and bacteria. Our sleep matters. So sleeping 7 to 8 hours a day makes a huge difference in our immune response and the initial immune response to the virus to destroy it before it takes over the body. So these are some of the practical things that the people in the community can do to take care of themselves. If you don't have a practical toolbox, you're going to be in fear. And fear is bad for your immune system. So you want to really do what you can, because despite our differences, there are ways that we can really take care of ourselves, which underneath all of our differences unite us as a community. We have to do this for ourselves and for one another.